Thank you. Good afternoon, everybody. Welcome to this meeting of St Helens People's Board. It's the first meeting since lockdown began, and on that note, given what we've witnessed in recent months, I'd like to invite colleagues to observe a minute's silence in remembrance for those in our borough who have sadly lost their lives to COVID-19. And also, on Monday this week, we received the awful news that Paul Sanderson, our former Strategic Director of Place Services, has passed away at the age of just 59. Many of us knew Paul well and worked with him for a long time. And I'm sure you'll all join me in sending our sincere and deep condolences to his wife Angela and all his family and friends. So if you could please join me in a minute's silence. Thank you. Thank you, everybody. Thanks for that. And can I just take this opportunity as well I know we're going to discuss COVID response in some detail later, but at the start of the meeting, I just want to thank all those present partners, organisations for the absolutely incredible work you've all done to help our residents in our communities in what's been an unprecedented few months and a very difficult time for everyone. But I just want to say thank you from me and thank you from the council. Okay, item number 1 is apologies for absence. I've had apologies from Kath O'Dwyer, Councillor Charlton, John Heritage for part 2 only, Carla Jones and Anne Marr, although Carla and Anna both sent substitutes. Item 2 is the minutes from the meeting held on the 11th of March 2020. Are they agreed by everybody?
Agreed.
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 Thank you.
Agreed.
3 is declarations of interest.
Nothing.
And 4 is People's Board revised terms of reference. I'm going to hand over to Sue Forster.
Thank you, Chair. Every year we revise the terms of reference of the People's Board and make sure that they are up to date and relevant for our business for the year. This year there has been a lot of developments since our meeting in March, and the council and its partners now have responsibility for outbreak management, which I'm sure many of you will have seen in the news. And as a result of this, the terms of reference have been changed to describe the oversight that the People's Board will have in relation to outbreak management, being the public part and engagement part of outbreak management for St Helens. We have also changed the terms of reference to include the new Executive Director of Place Services, as we will be having an equivalent board for Place Services, and ensure that we have included all the statutory functions of the council, for example, the Director of Children's Services and the DAS. As well as this, we've also included a representative from the opposition party to give a little bit more different balance to our political oversight part of the board. All the other elements that have changed within the terms of reference are either minor changes or they reflect changes in names of people that are represented already on the board. So I'm bringing this here for us to formally approve these terms of reference. That's over to yourself now, Chair.
Thank you, Sue. Are there any questions or comments from colleagues? If you can indicate either in the chat box on the Microsoft Teams system, or if you just, if you're not sure how to do that, just shout.
David.
Councillor Quinn.
Yeah, I think it's an excellent proposal coming to the committee in relation to an equivalent board for place. We've seen what the People's Board has done for integration and fetching health partners and the wider partners forward. And I think it can only lead place to go to a stronger position than currently in.
Yeah, agreed. Thank you, Councillor Quinn. If there are no more comments, can I ask if is that agreed then?
Agreed.
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 Thank you. Thanks, everyone. Okay, and thank you, Sue. Item 5 is Safer St Helens Executive Terms of Reference. Councillor Bell.
Thank you, Leader. At the previous meeting of the People's Board, the board agreed to a revised governance structure for the Community Safety Partnership function of its role. Since that agreement was made to review the structures, there's been significant changes with the onset of COVID-19 and the need now more than ever for organisations to work together. Today, the board has received an update on the work that's taken place, and we'll go into that in detail in the next item, and also our partners over recent months. But central to this is the ability to meet informally as a community safety partnership, which we have done frequently during this period, to have that space to discuss the issues relating to the safety of residents. The previous few months have demonstrated that this forum works well, and I'm pleased to present to you today a formal proposition for the creation of the Safer St Helens Executive, which mirrors the arrangements for St Helens Cares Executive. The report requests approval for a number of subgroups that mirror the priorities for crime and disorder locally, as well as aligning groups that already exist and required to function, such as Youth Justice and Prevent boards. The MEME group, which is Making Every Adult Matter, will bring together organisations to coordinate the support for some of our most vulnerable residents with complex needs. And work is ongoing to reset our approach to integrated offender management with our partners such as MPS, CRC and Merseyside Police. Finally, 2 new subgroups have been put together to lead on activity to deliver the domestic abuse strategy, which is a key area of focus for us. And a group to focus on place-based crime and disorder issues will also be created. The work of all of the groups will report into the executive, which will then update the People's Board and Cabinet. So the governance structure proposed demonstrates the range of areas that the CSP will need to progress over the next year. However, with the correct framework for coordinating tactical activity via the executive, this will ensure that the People's Board and Cabinet maintain that strategic oversight of the delivery of the Safer St Helens agenda for our borough. Lastly, I want to thank all of the council officers and partners that have been involved in this piece of work, in particular Samantha Murray, and our partners who have worked really hard to bring this together. It's fair to say that the work that's been undertaken by the CSP during COVID in keeping us all networked, informed and sharing information has been particularly vital. Thank you.
Thank you, Councillor Bell. I think it's a great report. I thank you and officers for putting this together and these recommendations in front of us. Are there any comments from colleagues or any questions? Is that agreed?
Agreed.
Agreed. Thank you all. Thank you. So it's a bit strange, isn't it? I'll be in the room. I can't see people nodding, so I'll just give everyone a few seconds. But I think we're agreed. I'll take silence as agreement. Okay. Item 6 is Councillor Bell again, and this is an update on community safety activities during COVID-19 pandemic. Councillor Bell.
Thank you again, Leader. So this report presents to the People's Board an update on the key service areas within community safety and how these services have been impacted and responded to the COVID-19 pandemic. The report highlights that in relation to domestic abuse, the services have undertaken a number of campaigns to reach out to victims of abuse and also to children who may have witnessed abuse during the lockdown period. As well as increasing campaigns, the services are focused on maintaining key services and functions such as the MARAC during the period. We know at Merseyside level that the reports of domestic abuse did not increase at the level that was reported nationally, but that was a particular concern for us because we didn't know whether we would have a larger response following COVID, and we're now preparing our services to be able to respond to that expected increase as restrictions are eased. And that was why a lot of our campaigns focused on online activities targeted at getting to people in their own homes. So this report informs the board that there's been a rise in reports of ASB during the lockdown period. And whilst any rise is a concern, we need to kind of set this against the context of lockdown. So with a change in the nature of ASB being reported, partner agencies have worked together to respond to the challenges during the period as outlined in the report, including our outreach services, and Merseyside Fire and Rescue have worked really well with us together in parks and open spaces, as well as the brilliant joint work that's been undertaken with Merseyside Police when enforcement was required. Finally, the report updates the board on the issue of hate crime and the levels of reporting over recent months. This is an area of work that the partnership is going to remain focused on post-COVID-19 as we work together to deliver the actions that are required. The key messages were that St Helens is no place for hate and that we are all better than that. And I would really appreciate any partners who've not already signed up to those campaigns to have a look on social media, have a look on the Safer St Helens website and get involved. Merseyside Police have prepared a statistical appendix to provide the data alongside this report, and Tammy Garvey-Jones is going to present this to you and to respond to any questions directly. I think it's fair to say it's been a really challenging period for us, and the work undertaken together as a community safety partnership to respond effectively to these challenges has demonstrated our commitment to making the borough a safer place. We know that this crisis is not over, and this winter may be a particularly challenging period too. But this report highlights that when a need arises, we can really work together effectively, captured by the underlying principles of St Helens Together. Thank you.
Thank you, Councillor Bell. Any questions or comments on this? Okay. Is the recommendation agreed then?
Agreed.
Agreed.
Thank you. It is an excellent report. I just want to thank Jeannie and all officers and partners who've been involved in the huge amount of excellent work that I know from first-hand experience has gone on in recent months. It's not been an easy time at all, but Councillor Bell and officers have done absolutely sterling work, so thank you all. Item 7 is St Helens Joint Strategic Needs Assessment 2020 mortality, and I'll hand over to Sue Forster.
Thank you, Chair. This is a St Helens Joint Strategic Needs Assessment, the specific chapter on mortality. And the reason we wanted to bring this to you today was we really wanted to understand what our benchmark is for mortality, both in the past but also going forward in relation to how COVID might impact on our mortality rates moving forward. You will see in the summary that it already highlights the impact of COVID at the time of writing, and the COVID dashboard sort of updates that as well, showing the fact that 188 registered deaths for COVID at the time of writing have had a significant impact on mortality for 2020. However, this report does go up to our benchmark of at the end of 2019, And you can see that we've still got wide inequalities in relation to life expectancy, with a gap of 10.4 years for men and 9.2 years for women. And we've not really made the significant in-depth indents into those life expectancy inequalities. And I think this is something that we might need to focus on going forward, because we really need to understand inequalities in a lot more detail, because we have reported them many times, but we know that COVID is likely to have another layer or add another complication to those inequalities. You will see that all age, all cause mortality for both males and females has remained static over the last couple of years, but actually we're still higher than national and regional rates. And for premature mortality, which is that under 75, it has fallen in 2018 for males, but the rates are only the same as they were in 2013, and for females the same as they were in 2015. So overall, what we're showing is that rates did go up, and now they're just going back to where they were before. Whilst for premature mortality we're above national rates, we are the same as some of our neighbours in the northwest, so similar to those. What I'd also like to point out that some of the underlying conditions or mortality rates seem to be particularly worrying, especially for men under 75, when you look at cardiovascular and cancer. So I would like us to sort of think of those, and especially once we start putting a COVID lens on those, we know that health conditions are a specific risk factor for those people moving forward. And obviously we need to really think about the impact of that over the winter. I think some of the good news has been around the excess winter deaths and how we've really tackled that. And I remember when I first presented the JSNA as being a council employee rather than being in the health service, that was one of the things that was highlighted by the Health and Wellbeing Board and by Cabinet. And the good work around excess winter deaths has really made a big impact in this borough. So it just proves that actually if you do have these reports and do something with them, they do make a difference. I think the chart at the back really shows the life course and some of the impacts and major impacts we are, and where we're high and where we benchmark well, which sort of gives us an idea that if we do some things early, even in childhood, we can have an impact on death rates later on in life. So I'll leave it there. This really is a document for us to use in our areas of work to influence what we do around those, and it will be useful to benchmark moving forward. And we are hoping to bring a inequalities JSNA in the next couple of months as well, which will help us highlight some of the issues there. Thank you, Chair.
Thank you, Sue. Thanks very much for an excellent report, as always. Any questions or comments for Sue?
Comment, please.
Yeah, Marley?
Yeah, it's an excellent report, as you've identified, Chair. I always find this report really interesting because it fetches the history of all our localities together, and it actually identifies the issues, be it age, be it illness, be it poverty, whatever the issues are. It also identified to me this morning when I read it again that some of our more affluent wards are the wards that don't perform as well in other areas. Example, warmth, winter warmth. And we have made a massive progress there. In the last year, 25% reduction in deaths. So some of our more affluent wards actually suffer in a different way than our deprived wards suffer health-wise. But it is all a health issue, and in the end can lead to, sadly, death. So it's a very interesting report, and I do think that it's probably one of the most valuable pieces of information that elected members and the public can actually look into and actually lobby for improvements in whatever area where they live suffer.
Thank you, Councillor Quinn. Councillor Burns and then Councillor Bell.
Thank you. Thanks, Leader. Yeah, Sue. Thanks very much, Sue, for a great presentation. And I must say, I really do like the JSNA report, because unlike some reports that are very text heavy, this is quite visual and helps to describe where we are. It gives a good indication of where we are regarding health and social care needs across the borough. But the next to last page, which is on page 71 in the pack, I think it's really good because it highlights the facts of life in St Helens, but also gives us an indication of where we are against national trends in an easy look where you can just have a quick look. And I think it's important that we all do review this information and look at how each of us through our partner organisations can help to improve things for our residents. Of course, the obvious thing to say would be to change the reds to greens. But there are two worrying points in there, and they're around obesity, which comes across in a number of the reds, and of course respiratory illnesses too. And these are factors that are worrying on their own, but even more so when you put them in the mix with COVID or coronavirus. And we all are worried about a potential second wave come the winter. So we must take it seriously, because I do think as we're trying to get back to some sort of normal, we're back at the pubs are back open, people are going back to work, that type of thing. It's important that I think we remind folk out there that it isn't over, and that things like obesity and respiratory illnesses are should be taken seriously when we think about a second wave.
Well said, Councillor Burns, an important point. Councillor Bell.
Hi, I just wanted to say thank you to the public health team for pulling this together. I know it's a huge amount of work, but it's actually a massively important source of information for cabinet members in the work that we do and the priorities that we set going forward. And it should inform a lot of how we kind of target our campaigns and a lot of the work that we do. So thank you so much for that. It's so sad to see that cancer remains one of the largest causes of death in St Helens. I think it was around 26%. It said in the report of all deaths, and that's heartbreaking. And we know that concerns have been raised about people seeking cancer treatment and diagnosis through lockdown. So we know that that may paint a more difficult picture once restrictions are lifted even further. So yeah, thank you so much for all of the work on this, and thank you, Councillor Burns. It's fantastic.
Thanks, Councillor Bell. Any further questions or comments from colleagues?
Can I just make a comment, Chair?
Of course you can.
Yeah, it's probably to just reinforce what Councillor Bell has just said, because I think whilst obviously coronavirus has been horrific for all of us and it hasn't gone away, I think what this report does is remind us that actually the leading causes of death in St Helens are cancer and respiratory illness, and actually obesity is a risk factor for both of those. So I think this is the time, and some of this will come out in my presentation, when we have to refocus on the things that were already our priority before coronavirus. And the People's Board last year did actually make cancer, particularly earlier diagnosis of cancer, a priority, because as Anna had once shared quite passionately with us when she was at the board, one of our biggest issues with cancer is late presentation. And actually that presentation is often delayed in some of our more deprived communities. So I do think it is time to start refocusing on some of the things that were our priority before coronavirus. And as Councillor Bell's just said, there is a genuine concern in health at the moment of the impact of the pandemic and stepping down a lot of services on cancer treatment and cancer diagnosis. So we have been doing campaigns locally, and Wiston have got a cancer hotline, but I think the more that members can do in their communities to raise awareness with the communities you serve, the better, because I think otherwise we'll have another health crisis next year, which won't necessarily just be coronavirus, it will be cancer and other treatments, particularly cardiorespiratory disease, because also stroke has been another area we've been really concerned about because people haven't been presenting with strokes in the same way. So I do think it's good that we've stepped the People's Board back up today, and I think we need to start refocusing on some of the health priorities and health inequalities in the borough.
Absolutely, Sarah. Thank you. John Heritage.
Thank you. Obviously, clearly agree with everything that's been said. I suppose I'm just thinking about looking at this from the other perspective as well, in terms of the psychological impact of this that we will see in terms of people's physical well-being, and then the psychological impact of that in terms of long-term condition management and treatment. Again, in St Helens, you know, that's something I know we are very focused on in terms of mental health care and mental health support, both in terms of resilience of communities, but also in terms of provision across St Helens. So I just wanted to make that point, that I think the two elements of how we provide support to people, you know, are really important going forward. Thanks, Leader.
Thanks, John. Any further questions or comments on this item? It is just for noting, so I want to thank you, Sarah. Thank you, Sarah. Thank you, Sue, and thank you, Anthony, for that excellent report. And item 8 is the COVID dashboard, and this is Sue Forster again.
I won't go into this in too much detail, and it probably follows on with the outbreak management plan and governance, but we will be bringing a COVID dashboard regularly to the People's Board. This is just the first version. Across Cheshire and Mersey, Directors of Public Health are looking at a standardised version for all areas, so we get to see the same. But you can see from this, from the start of COVID in total, from the day we started with cases to the day this was reported, we had 1,189 cases. And we were very high at the beginning of the peak of the COVID in April. Our peak showed that we had 194 cases a week, and currently at an all-time low with 3 cases. And actually, this shows if around us benchmarking across the Northwest, we have the lowest rate in the Northwest at the moment. However, you know, we always need to be careful around saying we're low, because we're only low because they've not been tested and found positive, because we know there's quite a lot of asymptomatic cases out there. You can see that the number of deaths, this is slightly updated from the JSNA, was 196, and of those 81 were in care homes, just showing the impact of COVID on our care community,
Sue,
and specifically on older people.
Sorry, Sue, can I just stop you there? Kelly, could we have this shared on the screen? I don't know if other people can see it, but I can't. Could we get the presentation up on the screen for everyone to see, please?
Yeah, I'll just try and load that up.
Thank you. Sorry, Sue, it's just helpful if people can. I know we've all got it, but they might be struggling like me on multiple screens with lots of different things popping up.
All right.
Thank you.
Okay. The chart on the first page really eloquently shows what our epidemic curve looked like, so you can really see that there. So we're down to now, as I say, 3 cases in the last week, so that's the lowest in the Northwest. But as I say, we need to be careful there, because there's a lot of asymptomatic transmission or asymptomatic cases, so we don't know what's out there. If people don't know they're unwell, they might not go and get tested. So, you know, we need to be careful around that. If we just go to the next page, this shows the excess deaths. So you can see that in week 13, this is all around April, May time, that our deaths were really quite high. As you can see, 81 were recorded in care homes, but the overall deaths now are down to the long-term average. And in fact, you can see there that some of the minus bars show that in some respects were below what the seasonal rates were. But over the year, we expect that our deaths will be a lot higher. And as you can see from the second chart, that the ones that were actually where COVID was mentioned. And I think what we need to be wary there, and especially in the early days of COVID, is that COVID was not always mentioned on the death certificate. So there is a lot of excess deaths there where you would actually assume that they may be COVID related, but actually COVID, unless they'd had a test, they didn't come back as a COVID related death. So it's just to let the board continuously see what's happening in our area. We will be working on this dashboard to make sure that we can get everything that's in the public domain to the People's Board so they can keep track of the way we're going with this virus, because we expect that this is going to be a complicated picture as we go into winter with flu as well, mixing or circulating in our communities. Thank you, Chair.
Thank you, Sue. Thanks, Kelly, for putting it on the screen. Have we got any questions or comments for Sue on that?
Comment, please, Chair.
Yeah, Councillor Burns.
Yeah, thanks for that, Leader. I know we often praise officers, especially when they're putting together reports and for a lot of the good work they do, but I really do think that Sue and the team deserve a medal for putting this information together. I mean, it's been well documented that data, surrounding COVID has been dreadful, from the government and from where it's came from, and just to try to make a head and a tail out of it to create a good report needs to be commended. I mean, there are deep concerns as we're trying to put together a plan to manage the outbreak and try to look after our residents as much as possible. The effort that's happened across the community, you mentioned at the beginning of the meeting, Leader, of the terrific public sector workers and everybody in the town who've got together and rallied around St Helens together, especially throughout the lockdown. To help support what we're going through, but now it's important that test and trace works, or track and trace works, and it just isn't. We need to make sure that data's coming through, that it's steadfast, and the government really needs to pull a finger out, I think, and make sure that the information we're getting isn't contradictory, but paints a true picture and is given to us in time. I mean, there's been various bits in the media, both the local and the national media, and to be fair to them, they've interpreted it as they've seen it, so they're getting the same sort of information that we're getting. So I think it's time that we stop talking about the data being rubbish, and time for the government to start sending it through correctly and on time.
Thanks, Councillor Burns. I totally agree. Any further questions or comments?
No.
Okay. I second everything you said about Sue Forster there in our public health team. Councillor Burns has been absolutely heroic throughout this, and I thank Sue and all the public health team and partner organisations, as I said before, for the absolutely incredible work that you've done. I think in spite of the support from government, not because of the support from government. Item 9 then is the outbreak plan and governance. This is Sue again.
Thank you very much, Chair, and thank you very much for those kind comments, but I think that's been replicated across the country. Directors of Public Health and their teams have worked really hard and could only do it with a good system in place, and I think St Helens together have done that. So this is really for information for the People's Board, as we had to operate in a really fast environment and get outbreak management plans ready and prepared and in the public domain. The council made an emergency decision around the outbreak management plan. So what I presented to you today is the summary report of our St Helens outbreak management plan, the terms of reference of our outbreak management board, and the terms of reference of our health protection board. And I've highlighted the web page that everything is on and will be updated and will be in the public domain, including we need to think about how we get the regular data in the public domain, bearing in mind it will be out of date as soon as it's in there. So it might be pushing it to national websites where it's updated, because more and more data is coming out as we speak. So really, today I'm wanting you to note what we've already done, and really to ask the board about what they thought or what they think would be useful for them to receive moving forward. So at the moment, the Outbreak Management Board and the Health Protection Board have been meeting weekly, and they will step up if there is an emergency at any point in time. And we have really been looking and scrutinising the data and getting some of our communications and engagement plans in place. But I would really like to ask the board what you would find useful to see in September, so that you can be assured that we are working on your behalf and for the residents and the registered population of St Helens. Thank you, Chair.
Thank you, Sue. John Heritage.
Thank you, Chair. Just to, I suppose, commend the borough really for their approach to the way they've engaged with partners and stakeholders in terms of outbreak management. So we as a provider trust are a part of the governance arrangements, as you'll see. But for us, when we heard a lot of the media hype, I suppose, at the beginning about what outbreak management plans were, first thing I did was pick the phone up to Sue Forster and say, Sue, can you tell me what this would mean for St Helens? Because as a provider, we were really concerned about what it would mean for our ability to get to patients in the borough, for our staff to move around the borough. And very quickly, Sue was able to demystify it, explain what it meant very clearly for people in the borough, and actually more importantly for patient care. So I suppose I just wanted to really commend the approach of St Helens about how inclusive you've been in this. And, you know, it's good that we're around the table as a provider, as are others.
Thank you, John. Any further questions or comments? If we move on, then I'll take that as noted. And item 10 is St Helens Cares COVID update presentation. This is a presentation from Sarah. Just very quickly, I meant to say, going back to the last item, if there are any comments, Sue's asked there for your take, you know, the take of partners on this, what information you would like, what information you would find helpful. If you don't want to share that now, or if you're not prepared to share that now, that's fine. If you could obviously contact Sue outside of the meeting, I'm sure she'd be very grateful for your input and your feedback. So item 10 is St Helens Cares COVID update. Sarah.
Thanks, Chair. And Kelly's going to do the slides for me because I was trying beforehand, but didn't look like they were going to share. So can we move to the next one, Kelly, please? That's it. So I suppose this is just a title one, but I think what it says is really important and reflects the whole conversation of the board so far, which is that COVID-19 has been a public health emergency. I don't think any of us could have ever been prepared for the full impact of it. But I truly do believe in St Helens, and everything we've heard from partners and through the presentations is we have genuinely responded to it as a whole system. And our one common goal has been obviously to protect all of our residents, but in particular the most vulnerable. And the purpose of the presentation now is to really just share with the People's Board all the good work that's gone on in the borough. And I'm sure we haven't included everything, but it was to try and illustrate how we have all worked together truly. And I mean, we were convinced before about integration of health, public health, social care, housing, voluntary sector, etc., and how coming together to work together to improve outcomes for people was the right thing. But for me, our response to the pandemic and how we've been able to work together has just reinforced the strength of the things we've been doing in St Helens. And I think the examples that I'm going to share with you now just illustrate that. I would like to thank Wayne for pulling together the acute slides, and John for his contribution on the mental health slides. And what I thought I'd do is I'll run through the slides, and if at the end any of the partners who've contributed want to add anything that I missed, that would be great. So Kelly, if we move to the next one. And I think Sue put this slide together, and I was reflecting on it before, because I can remember in December or January, Sue coming into my office when we were still in the Gamble, saying, oh, it looks like this thing in Wuhan in China could become an issue. And I suppose over my years in health and as a nurse, you know, we've trained for pandemics, and we've talked before about flu pandemics and that, and they've never really quite impacted the way we'd anticipated. So if you remember things like bird flu and all of that, and other things that we've geared up for, they've never quite fully impacted as this pandemic has. So I was probably, I'll be honest, was probably a bit blasé with Sue. All right, didn't really take a lot of notice, and it was only really 2 months later. And I can actually remember, I didn't remember it was the 11th of March, but I was actually just pulling up at Cineworld in St Helens to go to the pictures with a friend when Sue rang me. So it must have been about 8 o'clock at night. We've got our first case in St Helens, Sarah, and you know, it started to be really real then. And who would have believed that 2 weeks later we were in complete lockdown? So I think this timeline reminding us when this started, and when you reflect on it was only the 31st of December to where we are now, and the impact that this has had on people, communities, our services, you would have never ever really been able to predict that. And what Sue's highlighted there, 29th of April, and where we are now, we are moving into what Health are terming the second phase, and actually we're gearing up for the third phase. And what they mean by that is not phases of the virus. We don't know whether we're going to get a whole national second wave or whether it's going to be locally, but we are now at that stage where services, I think this is a much harder stage actually for all of our services, whether that's in health or social care, council services, because the ask now is to keep capacity and plan for a second wave of coronavirus, be prepared for winter, and we already know across health and social care how difficult winter can be, and yet get normal services back up and running. And I think for frontline or operational managers trying to prepare their services to deal with a second wave of coronavirus and potential flu, but also try and get cancer treatment back up and running, that's quite a challenging ask, and a bit like our schools gearing back up to open in September, have to get children back, do everything they need to do, but also put measures in place. So I do think whilst in some ways the peak of the pandemic or the first wave we're passing on, I think our challenge is probably more difficult now in these next few months than it was when we first went into lockdown. If we go on to the next slide, Kelly, thanks. So what we've tried to do is highlight some of our key areas of working and care homes, and I won't read out every word on this, but I think, you know, Rachel and her team should be absolutely applauded for how we've worked with care homes in the borough. And we've actually had care homes feed back to CQC about how supportive services have been in St Helens. And everybody really rallied round. So the relationships that our adult social care teams already had with care homes meant very quickly we could pull meetings together and work with them. But then when asks were coming down around infection control, the infection control nurses who are hosted by the CCG but commissioned by Public Health were able to very rapidly wrap support around our care homes, and they've been working 7 days a week on rotas to make sure that support's been there, and they're still continuing to do that now to support Public Health with the outbreak management. Whilst PPE has been a challenge across the country and we've got very close at times to shortages, again, all of our joint working in St Helens across all different services, we managed to get PPE to all of our services as and when they needed it. And whilst there might have been at times panic in the background and not quite sure if we had supplies, everybody worked together, and I'm not aware we ever had anywhere really without it. We also managed to share it across homes where people were short and across other health services, which was really good. We worked really quickly with care homes when it was becoming more evident that care homes were being affected by the virus to stop workers moving between care homes. We've built a lot of good understanding now of good practice and better practice in care homes. Clinical support, so again, testament to our relationships and way of working in the borough. GPs, the frailty team, the community nursing teams have all worked very, very collaboratively with our care homes. And we've done all of that not through having to contract them or commission extra new services. We've just had to pick up the phone at times when we've needed it and ask people, and they've done what we needed. Medication management has been another strength because, again, the CCG has quite a big medicines management team. We were able to put extra support into the care homes to help there. We've done an awful lot of testing. John alluded to this, North West Boroughs in particular, and St Helens and Knowsley hospitals have really, really helped us to have our local testing there running. There's been a team at North West Boroughs that have gone out and done testing for us and continue now to be part of our testing response. And right in the middle of the crisis, St Helens Hospital were offering testing up at the hospital for both health and council staff, which made a massive difference. We had a lot of oversight and then assistive technology. Go on to the next slide for me, Kelly, please. So in terms of care homes, loads of good work. Primary care and community care. I mean, we would have never believed, you know, the digitalisation of health services. And what I mean by that is being able to get an online appointment with your GP or an outpatient clinic at the hospital, be able to do that like this rather than having to go into an appointment. It's something that the NHS long-term plan that was published in January 2019 aspired to. And I'll be honest, I was a bit cynical. That'll take us years to get to do, and we did it overnight when we had to lock down. So being able to digitalise lots of our offer has really, really transformed local services. So in primary care, we've been able to triage more and do an awful lot through video consultations. Drop boxes was another way of getting patients. So that's where we've been able to drop equipment at people's houses. They've been able to, say, do blood pressure monitoring and then drop it back so people haven't had to do home visits. Specialists at Wiston have been able to offer advice and guidance over the phone or through video consultations. I've already talked about the joint working with community frailty and primary care teams. We put in place at the beginning a specialised end of life service. So this was a dedicated service to go out to people who were COVID positive or were dying and needed visits at home, but that protected some of our other frontline staff for having to go into more risky situations. We put an extra visiting car on. Hot hubs, so that was GPs kind of set up one surgery where if you thought you had coronavirus, you would go there rather than risking spreading the infection across all of our surgeries. And lots of care planning. And we've already talked about the cancer advice line at Wiston, and we've massively improved communication between GPs and the CCG. So the whole theme of all of these slides is we've gone on and we've worked together, and we already had collaboration and integration, but the way we've responded to the crisis, we've really built on those relationships again. Next slide, please, Kelly. And then public health, and we've already applauded Sue and the team, and I think that's absolutely right. It's a very small team, but they've stepped up, and throughout all of this, they've been there for advice and to guide us in the right thing to do. So obviously public health advice, Sue's been on all the calls with the Chief Medical Officer so that we've been right in touch with the scientific advice as it's released. They've advised us around PPE, making sure we're getting that right. The data and intelligence, we're very lucky with some of the skills we have in our team, being able to really understand the data and interpret it and use it in an intelligent way. Public health have been a key part of our support and advice to care homes, schools. I know Sue even just recently has met with head teachers around advice for opening schools back up. The work, and this again hasn't just all been in peoples and health. We've worked really collaborative and cohesively across with community safety, particularly around some of the vulnerable work with some of our homeless, and been advising there. We've worked in a really integrated way in the borough around vulnerable people and those who needed to shield, and we've got a cohesive plan for how, as shielding is paused after next week, how we make sure anybody who remains vulnerable, we know who they are and how we can offer them advice. And you've just seen the outbreak management advice and plans that the team have put together. Next slide, Kelly. More on public health. So, you know, all these services that Public Health Commission have continued, but they've not only continued to offer the core work they needed to do, they've been an absolute integral part of our response to coronavirus. So the Sexual Health Service, because the sexual health staff are trained in outbreak management, they're a big part of the response that we're now putting together with Sue teams and with environmental health in terms of managing outbreaks. CGL have been really involved in some of our work, supporting some of our more vulnerable, some of our homeless and some of our residents with addiction, and continue to offer services there. And I've been involved in Mersey Resilience Forum and some of the cells around the vulnerable groups, and we haven't had to raise up through those cells any of the same issues that other boroughs have had, and I think that's because of our integrated working. The integrated wellbeing service, the Public Health Commission have been an important part of our referrals through contact cares, particularly around wellbeing, and John mentioned this before. We do know that we've had probably an increased need around loneliness for people as part of lockdown, and this service, we've been able to refer into this service as well as into our IAP service and other services for people who may need extra support during lockdown, and I think that need will increase even further as we come out of lockdown. And then the 0 to 19 service have continued to work really hard and really closely with some of our children's teams, making sure that our most vulnerable children continue to get the essential visits that they needed. And now as we start to step normal services back up, to make sure some of our other 0 to 19 work is now back up and running. Kelly, next slide. Sorry, Kelly, can we move on to the next slide? That's it. So, and then in terms of the acute trust, obviously right at the beginning, the trusts were right in the middle of it, and we had to work really cohesively to get people out of hospital quickly, which we did. And as you can see there, the trust wanted to thank partners around that, because we did manage to free up beds at STHK very quickly, and throughout the peak of the pandemic, the hospital managed to keep enough beds to cope, which obviously was what a lot of the early response was all about. Obviously, as you can see there, we didn't fill in the X, but we know that 202 patients lost their lives at STHK. They won't have all been residents of St Helens. And I think it was fitting that we held a minute's silence at the beginning of the meeting, remembering people who've been impacted personally by coronavirus. And the trust has also done a lot of new collaborative working, and you can see there a list of some of the things: different ways to discharge patients, more digital remote working for pathways, better close working with care homes. We've talked about cancer, and now the trust, they had to create more critical care capacity, and the big focus now is how they manage to restore some of the business, some of the work back to normal, turning the taps back on, but maintain all the new infection control guidance that's there and maintain capacity for winter and for a second peak. And I don't think we can underestimate the enormity of that challenge. On to the next slide. And then in terms of mental health, and I know John has been involved not just in the work for St Helens, but across Cheshire and Mersey. But again, I mean, and some of these are positive. So one of the asks, as John's put there, from NHS England at the beginning of this year was that there should be a 24/7 all-age crisis line for mental health, and there was plans to get that up and running by January. And actually, a lot of that work has been brought forward now, and actually will be done. Originally, it was for April 21, and it looks like now we're going to be able to do all of that by January 21. And that's the positive, actually, that that's been able to get up and running so quickly, and will be ahead of schedule. As you can see there, in mental health, they've moved to a lot of triaging and video conferencing. And we need to keep hold of a lot of this as we come out of it, because it actually means that a lot more people can be seen. And we are getting feedback from users that people, especially younger people, do like telephone appointments, video appointments. There will always be the need for some face-to-face as well. And that's one of our challenges now. How do we get that balance right? Obviously, we've worked really closely with teams at North West Boroughs around the IAPT offer in St Helens. And also we've secured more funding around the mental health support in schools. So that's something that we were hoping for as we went into the crisis, and we managed to secure that bid during the middle of the crisis. So that will be a massive improvement for our schools. This slide just summarises, and some of this I've covered, but it just reiterates our integration agenda. So Contact Cares has been, Contact Cares has been kind of there now for about 18 months, but we formally launched it last year. I truly don't know what we'd have done in managing some of our vulnerable residents and the shielding and coordinating the discharges from hospital if we hadn't had contact cares. Again, that team there have been phenomenal. And not only during the crisis have they been able to support St Helens, they've actually also stepped up and helped with discharges for residents from Knowsley and Halton, which from a Wiston point of view was really important and kept the flow of patients going. We've talked about the mental health crisis line and the care homes work. The other thing that was part of our integration agenda that has really helped has been our integrated BI team. So if you remember, staff from the performance and business intelligence teams from the CCG, Public Health and the Trust are all based together and have worked together. And that has been really invaluable when we've been dealing with data from the government around the shielded list and trying to link that in with our GP practices and with other services. And we were able to add a field onto the shared care record so that anybody accessing the shared care record there'd be a flag that would tell them if that resident was shielded or not. And we're also now rolling out a new module which will really be important for case finding and managing coronavirus as we move forward. And that module has actually now just been funded for the whole of Cheshire and Mersey, but St Helens will probably go live with that first, which is really good. We talked about the testing, so North West boroughs have been really invaluable in how they've supported us with our community swabbing for coronavirus. And what we've also seen is some of our vertical integration of services has also been invaluable. So I suppose summarising there, what the coronavirus has proved, if we had needed proof, was that working together collaboratively and in an integrated way absolutely means you can give the best response to safeguard your residents. And for when we heard earlier about the JSNA around mortality, for me, the only way we'll reduce some of these inequalities long run, whether it's obesity, cancer diagnosis, mental health, mortality, is by working together, having shared agendas and shared teams, all working for the best outcomes for the people of St Helens. Move on to the next one. Kelly, we're nearly there. I think there's just one slide left, Kelly. That's it. This is just to show you that, again, we've been very proactive and the council have done this, the CCG have done this, and we've done this with partners. What we're doing now is trying to make sure we've learned all the lessons I've just shared with you, that we've learned them, and we're identifying the things that we won't want to go back and do as we come out of the crisis, the things that we've done well during it that we want to amplify and do more of, and the things we want to restart. So we're kind of in the process of finalising a health and social care recovery plan to make sure we capture everything. And then the last, that's it. Thank you. Happy to take questions. And I don't know whether anybody from North West Boroughs or Wayne wants to add anything from the Trust.
Thank you very much, Sarah. Absolutely excellent presentation. Are there any questions or comments, things to add from partners?
Comment, David.
Yep, Marlene, Councillor Quinn.
Yeah. Sarah was singing to the converted about integration, talking to me about it. But I've got to say, if anyone or any authority needs convincing of how it works, St Helens actions and the way it did work in relation to COVID should be the good example to everyone. Initially, we started off and yes, there was governance arrangements and all this type of thing. Then we went into the care share record. When we thought the investment into that, 2 million, lot of money, it's paid for itself 10 times over, not only in information, but in life that's been saved in St Helens and the quick actions. And that investment was 3 partners, be it local authorities, CCG and Hospital Trust. So everything that Sarah has said, I would endorse. Not only that, if we look at our voluntary sector, I don't think anyone could have envisaged so many people volunteering their services to our voluntary exercise that was carried out and is still going on. So there's been many positives, not only for the community, but for the services and the providers, but most importantly, for the health of our population moving forward. COVID was probably, I hope I never see anything like it again or experience anything like it again. But I've got to say, when you look at risk management, I don't think anyone could have envisaged a scenario like we've gone through. And I've got to say, whilst yes, testing and swabbing's still going on, and we've got to be vigilant, what we've got to do now is what Sarah said earlier in the report, and that is giving our public the confidence to come from behind those locked doors to attend hospital appointments, for children to get back into school, but always being vigilant about social distancing, washing our hands, and the way we mix. And from Friday, wearing our masks when we go shopping or wherever you feel it's required. And I think we've got to strengthen that message as we go forward. And hopefully, if we follow those messages, that will knock away any sign of a second wave or a lockdown in St Helens. But it is now up to the people of St Helens to play their part with our partners so that they won't have to go under the pressures that they have worked. Our carers, paid and unpaid, we will be forever in their debt, and our key workers. Thank you.
Very well said, Councillor Quinn. I'm sure we all second that. Are there any more questions or comments? Okay, thank you. And thank you, Sarah, for that excellent presentation. Thank you to our partners. Thank you so much. Item 11 is Adult Social Care Approach to Supporting Care Providers During COVID-19, and this is a presentation from Rachel Cleal.
Thank you, Chair. This report is for noting, and I'll keep it brief because it is quite a long report, but I hope you've all had an opportunity to read it. The report essentially, I hope, gives a sense of how the residents of St Helens and health and social care services have come together to support each other at such a difficult time. And I think Sarah's talked a lot about it in the previous presentation, but coming together that has further embedded, I think, the benefits of our integration. I would in particular like to take the opportunity to thank the 3,300 care workers in this borough who have continued throughout the pandemic to provide direct care to our residents. And that's direct care, be that in a care home or be that directly into an individual's house. And I would say that I've been personally floored by the continued commitment and dedication of the carers that work in our borough. I think finally, the other thing that I'd like to draw out of the report is that it hopefully outlines the financial challenges faced by the care providers in the borough as a consequence of COVID-19 and the approach that in an integrated way the council and the CCG have taken to support this sector and to continue to sustain the sector, because we know that we are going to continue to need this sector as in the coming months. What I would say is this approach financially is under constant review, and another report will be brought forward soon to actually look at the next 6 to 12 months in terms of making sure that we have enough services to support our residents, but equally we are able to support them financially. Happy to take any questions.
Thank you very much, Rachel. Again, an excellent report. Are there any questions or comments from members on this?
Chair.
Councillor Quinn.
Yeah, I've got to say the report that Rachel has put together is very detailed. The approach taken wasn't the approach taken by a lot of authorities, but St Helens did it their way and the way our providers work with us, and it paid dividends. We've always had excellent relationships with our care providers. We've been open to challenge them and them coming to speak to us. So it's a well-established, respected relationship. I think that has undoubtedly strengthened through COVID and what went on. And I'm extremely proud of all of our carers. Unfortunately, we have a government that it can clap its hands on a certain night in a week. It can give it lip service. But yesterday, pay awards was announced for public sectors, but the care sector, the ones that local government actually commission or deliver themselves, wasn't recognised in that. And as Rachel's identified, moving forward, councils all over the country are going to have to make some very, very unpalatable decisions. And I think we all need to do whatever we can with government or to government in lobbying for parity for adult social care and fair funding for that to be delivered for every individual that requires it. We have learned a lot. I'm sure a lot of our carers out there have realised I don't need a service. I can actually do this for my mother or my brother. And that's fine, that's great, because our method and our methodology around all of this is giving independence, strengthening independence, and for a person to remain in their home for as long as possible. But adult social care, without a shadow of a doubt, deserves to be treated with parity in relation to funding coming our way. Thank you, Chair.
Thank you, Councillor Quinn. Any more questions or comments? Okay, I absolutely echo what you just said, Councillor Quinn. You took the words out of my mouth. The fact that carers were ignored in the pay rise announced yesterday by government for 900,000 public sector workers. On the surface of it, good news, but the fact that carers were ignored after we spent 10 weeks and the government spent those 10 weeks standing on their doorsteps as well, clapping them. The least we can do is give them a pay rise to recognise the outstanding and vital work that they do. The system as a whole needs financial support, and paid carers need fair pay for what they do, and they're well overdue a pay rise. Thank you. Is it agreed to note that report?
Agreed.
Take that as a yes. Thank
Agreed.
you.
Yeah.
Thank you, everyone. Okay, item 12 is the date of the next meeting, which is Wednesday, the 23rd of September at 2:30. And now we move on to private agenda. So is exclusion of the public, item 13, is that agreed?
Agreed.
Agreed.